Hi guys, in this video we're going to talk about why does it take so long for certain people to lose weight when other people can lose weight 10 pounds in a week, okay? And primarily I'm talking about the person who is more menopausal and struggling to lose weight. And I know it's irritating, it's frustrating. You see other people that do a fraction of what you're doing and it's just taking so long. So before you give up, just hear me out, okay? So number one, this is what I found. It's really a combination of not just the fat on your body, it's the atrophy. And I created several videos on this before, and I'll put some links down below so you can get the full scoop. But I just wanted to tell you what atrophy is. And it's called menopausal atrophy, where you have this huge shift of adrenal stress in the body because you lose the function of the ovaries. The adrenal has to compensate, and so it activates a hormone called cortisol, which actually can stress you out. So atrophy is not a little thing. It's not a minor thing. It's actually a major problem, okay? It's almost similar in equivalence to osteoporosis, where you're actually having thinning of the bones. You're actually losing muscle fiber, okay? So you don't have as much muscle there anymore, and there's a combination of inflammation, loss of collagen, fibrous tissue, scar tissue. So if you go into this thinking it's a minor problem that you just need to exercise and strengthen it, you're setting yourself up for failure because these conditions take quite a bit of time to recover, okay? They could take months and months and even years to get it fully back, but you can actually recover it. But it does take some knowledge about how to do it correctly. So let's just talk about the three things that can cause atrophy. One is the cortisol, that's the adrenal stress hormone, and that's basically a lot of stress without sleep. That could do it. Menopause. Inactivity. Let's say you haven't worked out for 30 years. You think that might be a long time not working out. It might take some months to get that back. So if you haven't done anything for years and your muscles are completely atrophied, it could take a while to get that back. Okay, and you have to be consistent, but you also have to make sure that when you exercise that you give a lot of recovery and you never overtrain, because I've seen people just do one workout and it took them 2 weeks to recover. So just pay attention to that. And then we have insulin resistance. And I have videos on this too, where the cells have insulin resistance, so they won't let insulin connect anymore. Well, insulin controls the protein in the cell. So if you're pre-diabetic or diabetic and you can't allow it to go in there, well, that could be the reason why you're actually not improving your atrophy. So we want to handle insulin resistance. I'll put a link down below. You need to study that as well. In your mind, just say, okay, it's going to be a year. I'm just going to stick to this, and you will see changes. But since it's gradual, you might want to take a before and an after picture, all right? Go ahead and stick with it, and thanks for watching. Hi guys. Hey, listen, I created a pretty amazing evaluation quiz down below that actually analyzes your symptoms to find the cause, the root cause of all of your symptoms, the most likely cause. So take the quiz now, and we'll send you a report.